Okay, welcome everybody. This is going to be a really great session and lots of people joining. Yeah, very, very exciting. This is our session on leadership in social work, building on strengths. And we've got an amazing lineup, who we'll introduce in a couple of minutes. Just sort of to go through the introduction and a few housekeeping slides. Just bear with us. We've got a legal disclaimer. So any views, information or opinions expressed by third parties during Social Work Week are the speaker's own and do not necessarily reflect the views of Social Work England or its employees. Social Work England have not endorsed third-party contents. Social Work England accepts no liability for the content of third-party or sector-led sessions held during Social Work Week. Okay, privacy notice. So it's important to us by providing your information, such as your name, email address, you agree to us contacting you for the purposes of event management and evaluation. We won't use your personal information for anything else, only this purpose, and it will be retained for 3 years in accordance with data retention schedules.
Thanks so much, Catherine. Good morning and welcome to this Social Work Week session, Leadership in Social Work Building on Strengths. My name's Anne-Marie Glover. I'm a Professor of Social Work at the University of Birmingham, and I've got a real passion for supporting, equipping and building confidence of our social work leaders. And I'm sure most of you here to also do that. So we've a fabulous panel of speakers with us today who will be exploring some of the advantages of taking a strengths-based approach to their leadership and the value of meaningful engagement and co-production. And we know we've got a range of people with us here today. You might be a leader, a social worker, someone with lived experience, a student, or involved in policy or practice. And we want to hear from you throughout the session. So there'll be opportunity, as Catherine said, to contribute via Mentimeter. And I'll be asking you to tell us a few things, something about your experiences of social work leadership, the qualities you've seen or would like to see in social work leaders, and how we can ensure positive outcomes for those making use of social work services. And we'd welcome all of your questions and discussion points for the panel. So do say anything that you'd like to hear about in the Q&A function. So now for some introductions. I'd like each of you just to introduce yourself and your role, if you don't mind. And we'll go first to Robin, please.
Good morning, everybody. My name's Robin Miller. I'm an applied social work academic based at the University of Birmingham. And in my research, I build on the 15 years I had as a social worker and as a team manager and a senior leader in health and social care services.
Thank you so much, Robin. Looking forward to hearing from you. Next, Carmen, please.
Good morning, everybody. My name is Carmen Colomina. I'm a social worker by profession, and I work in the Social Care Institute for Excellence as a practice development manager, very passionate about improving social care practice and obviously within it the strength space.
Brilliant. Thanks so much, Carmen. Mohammed. Oh, hang on, Mohammed. We just need to take you off mute. So sorry.
Okay, yeah.
Thanks, perfect. Yes, great.
So, hi, my name is Mohammed Zaman. I'm a contributor with Argwick West Midlands. I'm also a carer, but I'm passionate about mental health and contributing in the community. Thank you very much.
Thanks so much, Mohammed. Corinne, over to you.
Hi, I'm Corinne Peckford. I'm a social worker by background and currently a team manager at Dudley Council. I'm passionate about strengths-based practice and leadership, and I'm looking forward to being part of the panel today.
Thanks so much, Corinne. And lastly, Jack, please.
Hi, everyone. I'm Jack Skinner. I'm a social worker. I'm service manager for the Preparation for Adulthood team in Bradford Council. So I've worked in adult services most of my time as a social worker.
Thanks so much, Jack. So we're all here because we've got an interest in social work leadership, and we're going to hear first from Robin. So we can remove our slide, please. We're going to speak from the heart rather than slides today, if that's okay. So that introduction slide can go. We're going to hear first from Robin, my colleague at the University of Birmingham, around some of the key messages from research and practice around leadership. So Robin, over to you.
Thanks, Anne-Marie. Yes, so the importance of leadership to professional practice is well recognised across health, social care and indeed the education sectors. Senior leaders give the overall vision and direction for organisation, and practice leaders are the people who are responsible for team cultures and climates, and setting up an environment in which practitioners and professionals can really respond to the highest levels of professional practice. And what we know from research is that's as true for social work as it is for other professions. What is distinct about social work from the evidence to date is that quite often people who are in leadership roles around teams and services can feel a tension between the aspirations of government and senior managers within their organisation and the practice realities on the ground in terms of the workforce feeling very pressurised, increasing demands and sometimes low morale. So sometimes people in those middle management roles can feel a real dilemma in terms of wanting to respond to the aspirations of senior leaders, but equally wanting to be true to the demands on their services. We also know that people outside social work have different views of what social workers should do. And that can then press leaders on trying to respond to different expectations of these different stakeholder groups in terms of motivating and leading their teams. And the final issue that we find from the literature that's available is that there's also a balance to be made for social work leaders in terms of the extent to which they focus on individual practice and the degree to which they use their leadership influence to represent and to advocate for different communities and to try and tackle social injustices, which is at the heart of the social work profession. We've also, as yet, not really articulated what a social work model of leadership is. So we've quite rightly learned from models of leadership in other professions, such as education, medical leadership and nursing leadership. We've looked at leadership models from different sectors and private business and so on, but we've not really articulated what would a values-driven model of leadership that would be one distinct to social work actually looks like. And one of the reasons we've not been able to do that is because the amount of research evidence for social work leadership is not yet fully formed. So that's something we need to work on over the next few years. And I think it's fair to say that the potential contribution of social work to leadership and to systems leadership in particular is enormous. And I think other people will be looking to us to try and take forward and to try and help us to understand systems working and all the various dilemmas and uncertainties in that.
Thanks so much, Robin. That's really interesting. I think thinking about leadership at every level, not just at sort of, the strategic level, but also within sort of communities and just so important to have an evidence base for those roles. So thank you so much for that. A good introduction to our session today. So this is going to lead us into our first Mentimeter question, and Catherine's going to put that up on the screen. And we're going to ask you to share a word, or more than one word if you have it, which describes your experience of good social work leaders. So that's the first one, please.
Is that showing up?
It's a different question, Catherine. So we want
right.
The first one. A word that shares your experience. That's the one. Fabulous. Thank you so much.
Do you want me to just run through for everybody
Please
how
do.
to use Mentimeter?
Please do, Catherine.
Great. Yeah, so it's really straightforward. You just Google in your browser Menti or Mentimeter, and it will come up with join. I think it's join an event or join something, join a Menti conversation. And you have to put in a code, and that code is 46928426. And clearly we've got 5 people successfully now on Mentimeter. And just how it works is, I'm sure many of you are familiar with that, but the bigger the word, the more people have said it. So this is really lovely to see. Complex and compassionate being the first 2 big words. So I'll leave that with you, Anne-Marie.
No, that's brilliant. Thank you so much.
Is it worth saying that number again for a Mentimeter in case
Please.
people were scrabbling with their
Yeah,
phones?
That would be great.
It's 46928426. 46928426.
Thanks so much. That's great. Wow. I'm just looking at some of these words coming in, and obviously compassionate is still there as one of our sort of most significant answers, and supportive and empathetic, but we can also see in there challenging and complex, variable, so many words coming in. And I think what we're going to do is, when we get to the end of this, we're going to save and perhaps be able to share that with people afterwards. But just looking at that, and just so pleased to see that so far that's what all of our leaders have been. And Robin's talked about that value-based and value-driven approach to leadership, and that's clear. So that's brilliant. Thank you. At some point, Catherine, we're going to close that when we've given people opportunity.
Yeah, I can stop sharing, but people can still contribute
Brilliant,
in the background.
thank you.
So I'll stop sharing my screen.
Please do. Thank you so much. That's great to have heard that. And another thing we know in relation to sort of social work values is that as a profession, we really value that meaningful engagement of people who make use of our services. And we also know that people, you know, in adult practice are very passionate about thinking about strengths-based approaches to practice. So we're going to now hear from Carmen Colomina, our colleague at Sky, to say something about the role of strengths-based approaches in practice and how that differs perhaps from strengths-based leadership. So Carmen, over to you.
Thank you very much, Anne-Marie. And yes, building onto Robin's explanation of leadership in social work, just to clarify, when I'm talking about strengths-based leadership, I'm not necessarily talking about your directors or your head of services. I'm talking about everybody who has the skills or the role and behaves like a leader. So we frequently hear a strengths-based practice, strengths-based approaches, strengths-based leadership. And sometimes I find that it is very difficult to know exactly what's one thing or another. And we use the concepts not really being clear what are the difference between them. So from our point of view, strengths-based, I mean, all of them have something in common. The principles are the same. It's about a strengths-based. Yeah. So being a strengths-based is primarily focusing on the strengths of the individual or individuals we are interacting with. Yeah. And those resources or strengths the individual can either develop or reach out to. Yeah. And that's when we are talking about strengths-based practice, generally is referred to frontline staff, social care, occupational therapists, district nurses, medical professionals, unqualified social workers. And it is those interactions with individuals in the community, whether they are people who receive services, people in the community generally, or unpaid carers. And it is about the type of dynamic that we create when we are interacting with the individual. And the key thing is recognizing what are the strengths that each of the elements of the dynamic are bringing into the table. Yeah. So as a social worker, I have certain level of knowledge and skills. And as an unpaid carer or as a person cared for, they have other strengths and other levels of knowledge. Namely, what is their life about? What are their personal outcomes? What things they have tried in the past? But the dynamic is such where there isn't a driving or a leading force. It's about both of the person or all of the persons bringing to the table those strengths and making the most of the interaction. And everybody being aware of what is brought into the table. Everybody is an active participant. There is no passive participants. Yeah. Now, when we talk about a strengths-based leadership, what we are is taking that to the role of a leader. So it's normally not an interaction one-to-one. It's about somebody who leads. And you can lead a lot of things. You can lead a team, you can lead a department, you can lead a project, you can lead an email account. I mean, whatever it is that you lead. It's about how do you lead? Because a strengths-based is not about what do we do, but how do we do things mostly. So when we are a strengths-based leader, what we do is, again, back to the principles, what are the strengths of the people we lead in? 1, 2, 20, 100, 500, doesn't matter. What are the strengths? What does everybody bring into the table? And how can we make the most of that as a group to maximize the impact and get to where we want to get? So that is the difference between the practice and the leader. Undoubtedly, a strengths-based leader does practice, in one-to-one interactions, not with people in the community, but with their people in their teams or people they work with. But it is more from the leading point of view than practice, social care practice, or a practice point of view. The other thing is important is both the Children's and Families Act and the Care Act 2014 recognize and mention explicitly a strengths-based, not the term as such, but the concept. So it's not only good practice, it's not only the best way forward, it's also a legal duty. And lately to say that also both on strengths-based practice and strengths-based leadership, the concept of coproduction, which is working with everybody who is affected by whatever we're doing, are absolutely fundamental and embedded within the practice. So that will be my summary of the difference between practice and leadership. Looking forward to your questions.
That's brilliant, Carmen. Thank you so much. And just really interesting to sort of think about how, how we're translating some of those strengths-based approaches in practice, both in adults and children, into leadership, and how it's just so embedded in policy and practice in all areas of social work. Thank you so much for that. Now we're going to hear from Mohammed Zaman around his involvement in co-production. So we're looking forward to hearing from you around that, Mohammed, and that we're going to do this via a bit of a discussion between you and Robin. So I'm going to hand over to you, Mohammed, and to sort of Robin to tell us a bit more about you and your involvement in co-production. Thank you.
Thanks so much, Anne-Marie. So Mohammed, and again, appreciate you giving us some time this morning. So Mohammed, you've been involved in a huge range of activities, I know, in terms of trying to improve mental health services in local mental health trusts, but also working within Birmingham and National Mind. And you've also been really involved in research and trying to make research in health and social care much more focused on what matters to people and communities. A huge amount of activity and demands. What was it that motivated you to get so involved in trying to improve services and research?
What motivated me was when I first got engaged with mental health services for people, and I found that it wasn't how it's supposed to be for the people, and I could see a big difference in mental health and physical health. So that got me interested in, why is there a difference? And I went to different kind of meetings, and I went to user-led meetings, which was more involvement, and they had more rights-based approach, and I could see that they were more engaged on the ground level of what's happening to services and why it was happening as well. So the reason was funding, the reason was also staff, staff resources, and also empowerment. There wasn't that much information in those days, so that got me involved in a lot of things to help try to change things. The more I knew about mental health, the more people wanted to take me onto meetings and panels, and I learned from there. So that's where I got more involved. By doing more of that, a lot of carers and service users want to be involved as well, so they could see a change on the ground level.
Fantastic. Thanks, Mohammed. And you, as you remember, were very important to the development of the strength-based leadership programme that we created with Sky through your work in the Health and Social Care Leadership Centre at the University of Birmingham. And you really helped us to kind of shape the content and the outcomes for the programme. And I wondered, is that because you would see yourself as a leader, because you do influence change and encourage others to do so as well?
I think everyone is a leader, and I think everyone has a passion. But they don't mention themselves as a leader. They just do it because that's part of their DNA of helping people. We just say that put people in boxes, but we think we normally should put them as human beings and treat people as in a human way. And I think the more we treat people in a compassionate, human way, we'll get more outcomes from people rather than in a clinical or a social model or medical model. Just treating, and that's what I found going to meetings, which are not highly pressured with information, with clinical or medical or social information. Just being having conversations. What was the problem? How can we resolve it? And what's the bottom line for everyone? And gaining the trust of people and professionals was in those days quite difficult. But over the time, co-production has helped a lot. We've I think for the mental health group for co-production was Dr. John Wallcraft. She's now passed away, but she was a forefront leader in co-production and getting people involved. And she's written loads of books and done a lot of seminars, and from that there's a lot of other subgroups that's happened to further the co-production, empower service users and carers, because I think it's also a rights-based approach that we need to look at as well in social work and in healthcare settings. We do normally lose the empowerment of service users and carers and what they can actually do in a positive way. Not like because we don't want to have barriers where professionals and carers or service users, discuss things but don't get things done. But we look at the problem, see what needs to be done, see where you can see where we can fit in or where professionals can fit in, and find out what can be realistically changed. I think also activism as well. I think with social work we need to look at activism, look at why it's happening. Is it political? Is it fund? Why is it reduced funding? Why isn't this happening? So we can create a movement, which I think the mental health group has created a brilliant movement, and social work can do the same. Have a movement, work together, join forces, learn from one another, and share good practices, and and learn from see what we can do better, and look internationally as well of other co-production service user involvement, see where we can do and improve, and move the strength-based practice, like you say, for everyone. And and because I think everyone has got history behind them. Some might know someone who's a carer, some might be a carer who are professionals, but they just have to sometimes it's good to talk to people who are to talk about their experiences and not just about the carers or the service users. And that's what breaks the ice. And a lot of conversations is where the empathy comes in, the compassion comes in. Just because social workers are not just robots; they're just human beings as everyone else, and we have to give people the space for people to talk, to relax, to enjoy, and move forward. And because it is, I congratulate a lot of social workers for staying and keep in their jobs, because it is a highly burnout rate for people. I don't think they get a good tap on their shoulder sometimes for the work they do, but behind the scenes there is a lot of let's say red tape that they have to do, jump over to sort out things.
Thanks, Mohammed. That's fantastic. So some of the things I take from that is that the importance of social workers as leaders collaborating with people with lived experience, the importance of setting up spaces where people can feel safe to be themselves and not just be a professional, and also a real call for action for social work to be activist, to kind of call out those injustices and to collaborate with others in terms of trying to address them. So that's a fantastic kind of foundations for us to discuss throughout the rest of the webinar this morning. Thank you.
Thank you,
Anne-Marie.
Thank you so much, Mohammed. I think just hearing about your passion for co-production and your areas of involvement is just so inspiring for all of us. And I think, we've really valued your sort of input into design and development of our strengths-based leadership program, as Robin has mentioned. But also, I think you brought us back to that word we've heard already about that compassion and real value in practice, but also in leadership. And good to feel that today so many people's experiences of leadership has been of one of compassion. So thank you so much for sharing of your experience and your motivation today. Thank you. Which leading us very nicely into our next Mentimeter question, Catherine, if we can share that one, and that is, how can social work leaders ensure positive outcomes for people who use services? So what's our role as leaders? Sorry, different question, Catherine. Yeah, if we can go back. So how can social work leaders ensure positive outcomes for people who use services? Sorry, that's a slightly different question, Catherine. I know you can't see the Mentimeter. Perfect, thank you. Very difficult when you can't see the screen there. So do you want to repeat the code? Oh, it's on the screen, 4692 8426. Great to see some things coming here. You know, communicating, listening, critical reflection, collaboration. Fantastic. Let's give it a second for those responses to come in.
I just say, in terms of the background, I was sort of watching the last question, people filling in and adding, which is lovely, just in the background. So yeah, that's been really nice to watch. And I think over 150 people contributed, just in terms of, you know, the technical side. So it's lovely.
Thank you so much.
And a little prompt for questions, because there will be a Q&A. So please, anybody that's got any questions for the panel, just pop them in there so that we can get them ready for when the question and Q&A session takes place.
Thank you so much. Again, we're seeing these values coming through around listening and collaborating, co-production, communication, understanding. I think, you know, we're reasonably familiar with how we can have a very tokenistic approach to co-production, but as we've heard from Robin, from Carmen, and from Mohammed, how important it is to have that sort of so meaningfully embedded into how we practice and how we lead. So that's brilliant. Thank you so much. Great to see this coming in. So I think what we'll do, Catherine, is we'll stop sharing that and we'll leave that in the background, if that's all right. And we're going to hear a little bit more from our panel, and I'm going to come back to you, Robin, just to kick us off. Really, you've talked at the beginning about all your experience as a practice leader, as an academic, and as a researcher. And can you sort of say, from all of that experience, what do you think are some of the advantages and opportunities of taking a strengths-based approach to leadership?
Yeah, so thanks, Emily. So building on what Carmen shared earlier about strength-based principles in general, what leaders are there to do is to give people a sense of a common vision and to develop that with them, to help them believe that actually this vision can be realised, and to motivate them to voluntarily put their resources and energy and enthusiasm behind that vision. And actually what really encourages to do that is a sense of we have got some capacity and some assets to be able to contribute to that. You know, we need to feel that our time and our energies will make a difference. And so recognizing our strengths and saying that we've addressed similar challenges, they might be different in scale or scope or focus, but actually we have been able to overcome things previously, will give us the encouragement and belief that actually we can make a difference now. So that's by building on people's strengths and helping people to see that they can develop what they've done previously can be really important. The second thing with strength-based practice is that it's not avoiding the difficult issue, and strength-based leadership doesn't avoid the difficult challenges. It's recognizing those, it's being honest about those, but it's saying that actually if we collaborate and work together, then we've got the best chance of overcoming them. And the third thing with strengths-based leadership is it's not about any one individual. It's not about the leader being able to do that by themselves. It's not about all the members of their team or the kind of wider coalition being able to do it individually. It's about a collective. So it's about recognizing that we need diversity of contribution. We need different people to do different things. It's giving people the confidence and belief in what they can add. And then it's kind of coordinating and connecting those up in order to make the most of our collective efforts. And that's why I think strength-based leadership is so much to give to social work, because one, it responds to the very difficult issues that we face, and two, it kind of builds on that social work values of be inclusive, and trying to get the best out of others and trying to build coalitions of the willing. And that's why I think it just fits in so well with our context and our beliefs as a profession.
Thanks so much, Robin. I don't know if any of our other panelists have got anything they'd like to contribute to that. Yes, Mohammed.
Yeah, so like with National Mind, with the could they give with the local minds, National Minds actually audit co-production, and they also have a mind quality mark. So maybe social work might want to do that. So they actually check it with the influencer participation manager to see how much co-production influencer participation is there for service users and carers. And they I think, and Birmingham Mind, I think, won it a couple of years ago for influencer participation. So I think that was good for them. And a lot of people then wanted the strategy to work with and how to get more people involved.
That's great, thank you, Mohammed. It's good to hear of those other contributions, many of which you make to enhancing practice. Thank you so much, Carmen.
Yeah, I just wanted to reflect in a couple of things that have been mentioned that are interesting, because we're talking about leadership on one hand, and on the other hand, we're talking about the collective and the group, and it's kind of, wow, how those two. And I was reading a quote the other day. I'm not good repeating them verbatim, but it was something on the lines of, is not the leader, the role of this leader is not about taking care of himself or herself, but the people they lead in. Yeah, and it is definitely about that. We talk about activism and we talk about change and a common vision, and that's the thing. It's not for the leader to do, it's for the leader to create that context where things can happen, where people feel motivated, enthusiastic, capable, able of doing things. And that's the role of the leader, more than doing or even delegating, because it's not even about I have the responsibility and I delegate it. It's about my role as the leader is to ensure that everybody I'm leading feels I can. Yeah, I can and I will, and I go for it. So just to reflect on that in terms of, because I think the collective could get a bit lost with the leadership, and it's important to highlight the weight of both things.
That's great, Carmen, and actually leading others and leading self, I guess, before and at the same time as you're leading others, and taking care of yourself is also so important. Thank you so much, both. Corinne.
I think what Carmen and Robin and Mohammed have said is so interesting. I think we do so often as leaders without thinking a strengths-based approach. So we understand what our team are good at, we know, and we celebrate those successes with them, and we move our best players into their best positions at different times. And that's all about our strengths-based approach as leaders, really understanding the skills and experience that we have within any service, but also, like we say, as a collective, you know who to go to for certain things because they're the people that are the best to ask that question to. When you start reflecting around strengths-based practice and then how it is translated within leadership, I think we start then to understand how we are already strengths-based leaders a lot of the time, and we're already putting those things into practice.
Yeah, that's so important, Corinne, and actually just being able to articulate that and recognise when, we're perhaps not leaders, but that is what we are doing is so important. Yes, Mohammed.
I think it's also important that the person who designs a strategy for influence and participation to have, because they believe in it themselves, but to filter it down to the managers and staff as well, because it is going to be a system change. And to have a system change, people have to think differently and do things differently, because in the past you might be saying, oh, I'm caring for this person, so how can that be in co-production, or how can this person be fully integrated into co-production? But it's the idea and the ideology that needs to be changed, and not just participate in itself.
you're so right, isn't it? Not just practice, but what's behind. You know, we've heard about legislation and policy being real drivers for this approach, but actually, you know, how are those leading and deciding how these things are implemented in practice is so important. Thank you, Mohammed. Jack.
I think on that point, Mohammed, it just sort of sparked a thought about the distance from the leadership to the people that are actually seeing people day to day is really important as well. If you don't have that authenticity to understand what's actually happening on, you know, the shop floor, as it were, for want of a better expression to describe that, it doesn't become authentic. It's not. There's a lack of awareness, and it's a difference between being a good manager and a leader. Sort of, there's a fine balance to be struck between those two positions.
Yeah, there is, Jack. So it's so important. And actually, people can be leaders even when they're not in a management position or have a management role, of course. So thank you. It sort of leads us nicely into our next Mentimeter question. We've heard about people's experiences of leadership, and it's good to see so much of that always positive. And our next one, describe some of the skills and qualities of good social work leadership. So what, you know, do you want to see? What have you seen? You know, what does good social work leadership look like? So Catherine, over to you for our Mentimeter slide.
Yes, I'm just having a little technical problem because I went to the end of the presentation. So if you just bear with me,
we can bear with you, or we can move on. What would be helpful? We've got to. Should we move on?
Move on, and I will get it up. Yeah.
Great.
Sorry.
Okay. Well, why don't we do that? Because I want to hear from Jack and Corinne. And Jack, you've very much been involved in sort of co-production in your leadership and your practice. And I wonder if you could share some examples from your practice of how you've been able to engage in a really meaningful way with people with lived experience.
Yeah, I'd be glad to talk about a couple of things that we have done. I won't take credit for this. It's very much a joint effort that my employer sort of really adopted and embraced, really. And so it's three things really. My job is in preparation for adulthood. So transition is service, so that link between children's legislation services to adulthood. And we thought it was really important to really set the scene and sort of say, actually, it's very different. There's a whole new set of rights and responsibilities. And so we created what we called a welcome pack, a sort of easy read guide, not to replicate or not to sort of say this is the only way of communicating with someone to hand over a pack and there you go, but just to complement some of the work that already takes place. So we co-produced this pack with service user groups and people who have experienced social work in the past. One of the sort of documents within that is a statement of rights. So that's a forum of people that have had social workers in their life about how they want to, what rights they want to have on the table before we even start. So that sort of tells the social worker that eventually picks up that situation to say, well, I want to be treated fairly. I want the right to have education, the right to get married, all those sort of things that are basically sort of human rights, really. And we get the social worker to sign that, and that could be really powerful to sort of set the scene to begin with. We also send out a profile of the social worker in advance, so that when we start to build relationships, we reveal a bit about ourselves. So it might be something as simple as my favourite football team is Arsenal Football Club, or, you know, and that sort of begins to build those relationships. So we're straight away from the first contact trying to get away from a conveyor belt of social care. Here you go, this is what you can do. And by the way, there's charges attached to some of the services that we provide, to building that relationship, getting beyond that first initial conversation, even before we've met that person. And I've seen it work really powerfully, where the the carer or parent will pin up the picture of the social worker on the wall, so that it sort of really eases those anxieties before we set foot in the door, really. And so when we've sort of sent that provisional pack out to all these people that we work with, stakeholders in the local area, they've said, yes, that's a really good idea, let's do that. And so we've started to bring that into practice. That sort of kind of leads on to I think something that is really powerful in setting the scene about how we want social workers to behave in practice. So we started to bring in experts by experience, so people that have had experience of social workers, into the interview room, and they sort of come up with their own questions, and it sort of adds a layer that we just couldn't do any other way. You know, the way that they put on the spot people that are applying for their quite often their first and biggest moment, job of their career. It sort of sets apart. Actually, there's technical competencies and things that employers want to see, but actually, why are we recruiting social worker? It's not for us; it's for people that need that presence in their life. And there's things that I've seen in those social work interviews that you just couldn't do, you couldn't replicate, and it's recruiting to values really more than anything else. And that also brings in so many other dynamics in terms of, well, that person may need a social worker, and it might be the person that you've been interviewed by at some point. So it really rebalances how we value social workers and their engagement with people. And as a social worker, you don't really have that many observations in the field. Really, you maybe have visits when you're a student, and observations where there's two social workers in the same place, but actually we don't really get to test that in practice. So that's something that we're really looking at the moment, about what observations do social workers go throughout their career. And then the other thing about that leads on to that is that actually the people that we use for social work interviews, the experts by experience, we pay them a sort of a wage for their time, actually. And that sort of sits in well with one of the other projects that we've got about employment. And so we started off an employment project about 2 or 3 years ago. Actually, we're in the third cohort, where there's placements within the council, within our team. And as the biggest employer in the local area, quite often they end up having jobs at the end of the programme in different services, where we work quite closely with environmental health and public health and other partners. And I've seen quite a shift in terms of how we value employment for people with disabilities or learning disabilities, and the way that we work alongside in the same office has created other sort of opportunities, and it really plays into that values-based social work ideology, I suppose, when actually the people that you're working with actually working to the next desk along, it changes the dynamic a little bit. And I've got the humility to accept that we're not perfect, and actually some people need a lot of adjustments to their work, and we really sort of go into that job carving or crafting sort of aspect, where we sort of say, well, actually some people are really gifted at certain areas and not so keen on other areas. And I think we're all like that to a large extent. We pick and choose the things that we're really good at. But there's, all of that sort of, they all tie into each other. And I think it's been a bit of a culture shift in the last sort of couple of years, actually, for our service.
Jack, that's great, and so wonderful to hear of some of those practices in your authority there. I'm thinking back to one of my interviews for a social work post over 20 years ago with a panel of young people, and it was for a youth justice, soon to become youth offending team, and what that sort of spoke to me about how much they valued those young people and their views about the staff who were going to be working with them. So thank you so much for sharing that. Robin and other panelists, please do come in with any thoughts.
Yeah, no, thanks, Jack. And I think a couple of things that struck me in what you shared there. They're obviously very great examples of kind of leadership in action and creating the space where that kind of co-productive and innovation practice can be undertaken, which is great to hear. And I think you talked about social workers not having many observations in their practice once they get beyond qualification. But I think that's even more the case for leaders. And I think I'm a strong advocate that leadership is a form of practice that is something we should constantly be developing. We should be taking in insights from others, both good and bad, in terms of what we do, and trying to reflect on, how did I lead in this particular context? And what could I have done differently? And I've been to know, is that your kind of response to that, Jack? Is that something that you would share as well?
Absolutely. I was going to bring it up earlier, actually. I think that it's once you get into a sort of, if you choose to go into management, it's sort of, it's such a culture shock almost, because you're not really having that direct practice with anyone. And so from a somewhat selfish point of view, actually sort of leading on sort of recruiting experts by experience and sort of developing that as a way forward, it allows me to spend more time with people that that I had at one point in my career spent every day working alongside. So from that perspective, it works really well, and it allows people that are in a leadership position to have those contacts. One of the things that we tried to do, we haven't really fully sort of realised it yet, but we wrote a job profile for that role, and sort of part of that was about sort of creating a focus group, so that maybe a senior leader or principal social worker could, sort of say, well, actually, here's my advisory committee of social work practice, what's good and what's bad, and use it as a tool to sort of drive up standards, really.
Thank you so much, Jack and Robin. That's such a good point to bring in on. Colin, I know you briefly had your hand up. Were you going to come in on that? Please do. Just
sorry,
thank you.
Just gone down somehow.
That's fine.
Yeah, I was just gonna say that that was absolutely interesting, very interesting, Jack, because that was another point, isn't it? We talk about strengths-based leadership or leaders, and somehow we may be transmitting the idea that we have to know everything and be good at everything, yeah? And that's not really it, isn't it? And that's why it's kind of starting from the leader of self, acknowledging what are our strengths, what are our weaknesses, as well as what are those of the team. And, I know I'm not good at certain things, and it may be no reason why I pursue to be better, but then in my team, what I do is identify who is good at those things and bring it in. And as Mohammed was saying, if I don't have the angle of the people from the community or people with access in social services or unpaid carers, that's something I need to bring into the table. If I am too detached from frontline practice, I need to be in touch. So it's not about being perfect or being strong of everything. It's about leading with strengths, which means identifying the strengths of the team and ensuring that whole system, holistic, is there, but not as necessarily covering all the angles.
Absolutely, value of the whole team, so important there. Thank you. Robin?
Yeah, and just I think another linked issue to this, to build on this discussion, is I think social workers taking on the identity of leaders is often challenging, and certainly in the programs that we've done, in which we ask people to do a 360-degree leadership assessment, but not one of the ones that you do online, but ones where you actually go after and speak to people and say, what do I do well as a leader? What could I do differently? One of the challenging things for people often is just to articulate, as a leader, what do I do well? And that's actually really quite a revelation for people, and often little bit nerve-wracking to actually self-declare as a leader. And I think it's one of the great things about our profession that is we are by nature quite humble, and we see others as contributing as much as ourselves, but that also sometimes perhaps could make us miss opportunities to have influence and to be willing to take up that identity and that mantle as a leader in order to tackle injustice and make things better. So there is something, I think, about social work, and it'd be great to get people's comments in the chat on this about, do we find it harder to adopt a leadership identity than some of our other colleagues do in other professions, say teaching, medicine, etc., law?
That's so interesting, Robin, and picks up on the things you spoke about at the beginning about sometimes social workers are learning from and drawing literature and research evidence from other disciplines. And, you know, is leadership a word that we are somewhat reticent to use? Perhaps that would be really interesting to hear more of. I agree. Thank you. Corinne, do come in.
So Robin spoke there about the strengths-based leadership programme and the 360-degree appraisal, and that was something that I went through. So about 4 years ago, I was a social worker who was acting up into an assistant team manager post. Never thought that I would be a manager. Thought that social work and management were two separate identities, and that for me it wasn't something that I ever thought that I sort of wanted to be part of. And that appraisal really was transformative for me in the sense of understanding how other people viewed me, and they said things that I didn't see in myself, and helped me to really understand that those values that you bring to social work are the values you want to see in the leaders of your social work department. And you want, while we think about like management and leadership, they are separate things, and we talk about leaders at every level. I think we want to see those really good social work leaders in management positions, and part of what I think is really important is encouraging those really good leaders to be in those management positions and to understand that they aren't separate. They can, you know, that they are separate, but leaders can be really good managers, and but really good managers, sometimes that's just their limit. They can't get beyond being a really good manager because they haven't got the skills and values of a leader. I think that really spoke to me there, Robin, about sort of how that dynamic changes, and how, yeah, social workers can be such good leaders, and we need to really value ourselves in that.
Absolutely, Corinne. So valuable and important point to make. And thank you, all of us, for those responses there. Catherine has been busy in the background sharing the Menti question, which was our skills and qualities in good social work leaders. And I think we're going to share some of that now. I think people can still contribute. Is that right? Can they still contribute? Is that still open for people to do so? Yeah, brilliant, which we are now, as we can see. And again, wonderful to see some of those values again coming through about, you know, being empathetic and approachable, and how important those things are. And we've heard sort of so much about leadership and leadership in social work, and how it's important to see ourselves in that role, perhaps even though historically that's been something we've been reluctant to do. So that's great. We'll leave that running in the background then, Catherine, if that's all right, and then people can still contribute. Corinne, I'd like to come to you next, if that's okay. I know we sort of said a little bit about that already, about when people want to make a real difference to their, you know, to practice, and, you know, through their own contribution and leadership. So, you know, how do we promote and support positive change when, you know, we aren't in those formal, you know, management roles as such?
Thanks, Anne-Marie. Yeah, I think it's sort of building on the point that I was just making, really, that we need to see management and leadership as separate things, and sometimes management brings with it a degree of power to affect the change that we'd like to see. And I think as social workers, we'll have seen colleagues who are excellent leaders, and we may start to reflect and actually see that within our own practice as well. So I think just that reflection again, that leaders, it's not role specific. We can have qualified and unqualified colleagues that are really brilliant leaders. And what we see, I suppose, in those positions is people that encourage others, people that listen, who have a clear vision and are really able to articulate that both to the people that they work with, the service users and citizens that they're working on behalf of, and then how they translate that to senior managers to try to start to affect the change. Obviously, we talk a lot about leaders and positive change, and I think we have to remember that not always do we have the power for change to happen. We're constrained. We work a lot within local authorities and a lot within budget constraints and other issues that stop that change happening. But that leadership as someone who's not in a management position, it's not about making the change happen, but getting our colleagues to collaborate with us, to speak to the right people, to get everybody along for that journey. I spoke earlier about sort of that understanding. We do it every day. We know who to go to for the, to get certain information or advice. We're using strengths in our colleagues all the time, and we need to recognise that in ourselves we've got those strengths. We're encouraging others. We've got that clear vision. We're articulating, and we're often celebrating the success of others, and we're making sure that that success is heard across teams and across the boundaries that we face. So I think for me, it's recognising the skills that we'd like to see in others, in ourselves, and giving ourselves that permission to see ourselves as leaders and to not wait until you're in a management position, because that might not be the right leadership role for you. I think hopefully hearing from the panel today, and as I say, as Anne-Marie said, I think we've spoken a little bit around this issue already, will hopefully help some of the people that are here today to sort of start to see themselves as leaders and think about how you can use those skills moving forwards in whatever role you decide to be in. I mean, I'd love to see great leaders in management positions across authorities, but that's not the only role that great leaders can be in.
Absolutely, Corinne, and I know there's literature we've looked at in the past on the strengths-based programme about the importance of leadership in a strengths-based way at every level, and citizen leaders, locality, that strategic level, whatever you see yourself as, you have opportunity to influence and make a difference. So as we've said, thank you so much, Corinne. Robin.
Yeah, no, just to build on what Corinne has shared, a couple of points. One, when I was a team manager, sometimes the people who came in and disrupted our thinking as a team and helped us to reset our vision were social work students who would come in, and they were very alive to the principles and contemporary practices of social work, and they would call out and they would question, well, why do you do it that way when actually that's not in line with what we currently know is most beneficial for people and families, or that doesn't seem to be in line with the core social work values that I've learned. And I just want to put the responsibility on students for doing that, but actually students, when they articulate that very constructively and clearly, can be a really important kind of thought leader within their teams. And the other thing I think is that we're obviously the session today is on leadership, but actually we could do another session on followership, which is actually a very complicated activity as well. And all of us will be leaders sometimes and followers in other times. And actually being willing to be a good follower, so somebody who will give their commitment, but not not unquestioningly. So somebody who's actually quite honest with a leader and will share their concerns constructively, is willing to discuss and debate, but then ultimately will go with the consensus view or will follow the vision that they feel that's best articulated. It is actually a really important skill as well. So there's something about being a good follower is also as important as being a good leader too.
That's really interesting, Robin, and sort of making me think about some of the models of leadership, distributed models of leadership where, actually we're sharing that power and role isn't important, but we're acknowledging everybody's place to make a contribution. So perhaps leading in one context, following in another, and being a good follower, as you say, is so important. Thank you. Carmen.
Yeah, I just wanted to pick up. I loved the comment Corinne made about I would love to see more leaders in social work. And I would too, I have to say. I will actually love it. And I was thinking how, in a way, I think being a social worker it has an element of leadership. I mean, social care I mean, social workers, we are change agents. I mean, it's one of the things we do. And it is true that sometimes we're part of complicated systems or organizations, and we can't because we don't have the power or the authority to bring change. But that doesn't mean, as Robin said, we can't challenge constructively the status quo to start, putting the seeds down for change to happen at another stage. I always say, from my point of view, the CARE Act 2014 is the outcome of years of people from all the angles pushing the boundaries out and testing things and identifying good practice and researching and evidencing. And then, yes, 10 years down the line, that comes on, this is now the new legislative framework. So I'm sure a lot of all the contributors to that didn't see themselves as leads for change in social care or as change agents, but they were because it's there. So it's not about big changes and boom things, and it's about pushing the boundaries, are questioning the status quo, being reflective and looking at research and evidence of what is best and what's not, and smaller steps to get to where. And that's also a leader. You don't have to be Nelson Mandela to be a leader. You can just lead those smaller steps.
That's so important, Carmen, isn't it? And, just seeing the importance of your one can be like a cog in a much bigger wheel of cogs that actually makes a huge difference, as Jack was sharing about, introducing people with lived experience into those interview panels, and the difference that made to practitioners that were employed, to outcomes for people in the future. So that is such a valuable point to make. Thank you so much. Mohammed, do come in.
Yeah, I'd agree with Carmen, what you said about you don't have to be Nelson Mandela to be a leader, and it's the small steps that can make a change. And that really reflects because of the BME communities. They're the ones that are underrepresented, and those are the people. A leader needs to be flexible and understand that different communities have different ways of communicating and different needs. And I think a leader also needs to look at the policies. Are they very rigid for certain communities? Are they flexible? And that's where a vision, of how things needs to be done differently. And co-production, again, what Carmen was saying, the small cogs, co-production from small groups, what they're saying, the Social Care Act didn't just come from professionals, it was also involvement of carers and service users input.
Absolutely, Mohammed, and it is that representation. People have heard me talk about this before, the importance of diversity in that representation. So we're not just asking for contributions from people that are like us or are around us, but actually ensuring that all of those voices are kind of heard in that context, which is so important. Thank you for that. Carmen, I'm going to come to you next, if that's okay. I know, we've heard a lot about the importance of co-production in practice and in policy and legislation, but we kind of know that some people in leadership will have some challenges around that and some concerns, and it's important to kind of acknowledge that. But how can we take a positive approach to risk when we are co-producing aspects of our work?
Well, I think, we know that positive risk-taking or positive approach is part of a strengths-based practice or leadership, and is fundamental for it, and it also links with this bringing change and moving things along, because when we do positive risk-taking on anything, really what we're doing is we're not only looking at the word risk, like potential negative consequences, we're looking at the positive potential benefits that action or decision or behavior can bring up. And we look at both in an equal weight. Yeah, obviously we weight them and we assess them to see which one will or could weight more, but it could be the potential benefits. So the initial identification of potential benefits and negative consequences is objectives and neutral, and then we assess which one weighs more. And for me, in co-production or policy or leadership, in any area really, the important thing is when there is a potential negative consequence, is everybody who could be affected by that potential negative consequence completely understandable of what impact could have on them, and therefore do they acknowledge that it's worth taking the risk, taking into account the potential benefits that could bring. And when there is no lack of capacity, that's really all it is. You know, I don't know, when I'm co-producing, and I'm going to put examples in my work, for example, I do know, and we all know, when you bring more people around the table, there is more difference of opinion, yeah? So that means you're going to have to be more on your feet when you're facilitating, you're going to have to be much more clear about outcomes and about, you're going to have certain skills about bringing people together, you're going to have time and enable, you know, for calendar alignment, all those things are there. We can call them risks. Fine, let's call them risks. They could be risk. But what is the potential benefit? The potential benefit is, rather than me saying, this is what my experience tells me that is good, I'm hearing a lot of different angles. I'm learning. I'm being challenged about what my status quo are, and my experience. I'm having different experiences. People may bring, I don't know, studies, evidence that I haven't. So those are the potential benefits. Yes, it may take longer. It may be more difficult, but the potential benefit is it will be better. Now, do we want to take that risk? And I understand sometimes in organizations like local authorities, it's a question of can we, not do we want to. I do acknowledge that, yeah? There is a lot of circumstances when it's not our decision, but somebody else, yeah? But we need to look at how can we get as much as possible. And obviously, co-production is about co-producing, not just telling some people, this is what I'm planning to do, what do you think? That's called engagement, yeah? It's a very different scenario. Now, sometimes for very reasonable circumstances, all we can do is engagement. And I'm not saying that's wrong. It's better to do engagement than doing nothing, okay? But if you can push it up the ladder of co-production to co-production, that's even better. So it is about acknowledging at every point, what are the potential negative consequences? What are the potential benefits of this? What are my real constraints? Can I move those boundaries to reduce the constraints? And then push as much as you can within your role to maximize the potential benefits. That's really what positive risk-taking is about when you are a leader, pushing as much as you can for the benefit of everybody, really.
That's brilliant, Carmen. Thank you so much, and a really helpful antidote for perhaps people who've got some concerns about that. Thank you. I've just heard from Catherine. We've got some great questions in the chat. Oh, apologies, Jack. I've just seen your hand go up. Please do add to that, and then we'll come to a question from Catherine.
What Carmen was saying was really just going back to that statement of rights. The thing that our Young People's Forum put together, one of the things that they wanted to a social worker to sign was that I will be treated fairly and I will have the right to take risks. And so, you know, that feeds really nicely into the fact that social workers may get a lot of grief from other professionals about, you know, on your head be it, all those sort of things that we probably have all heard at one stage or another. But actually, what I always need to remember is that social workers spend a huge amount of time learning bits of law, bits of case law, bits of policy, what the Care Act says, what it doesn't say, and that knowledge isn't really shared or as present in other professionals. And so we need to be mindful of, actually, there's a reason why we're siding with the person when they want to go skydiving, or, you know, I always remember a bit of case law about, you might remember it, but it's from about 10 years ago. I think it was a lady called Peggy Ross that wanted to go on a cruise, and it was in the Daily Mail because the social workers at the time, 10 years ago, decided, right, it's not in your best interest because what might happen on the cruise, you might not have access to it. But what they didn't really understand was the context and the fact that her husband had been taking her on this cruise for years and years and years. And what's the bad thing that might happen? Well, you know, what and Carmen, you pointed out, well, what is the benefit of taking that perceived risk? You know, going on holiday when you're, you know, in a residential care home, you know, every other week of the year. So there's things like that that sort of make you think, oh, actually, there's such a wider picture and context to a risk that is not always negative.
And it takes me back to that word shared at the beginning around compassion. You know, driven by values would perhaps have a different approach rather than risk. Robin.
Yeah, no, thanks. I mean, I think you're right. I think in terms of social work, I think we've got a real skill and understanding of working with people on an individual basis in terms of thinking about risk and management risk. And there are some excellent examples of social work leading in a co-productive sense. But I think there's more we can do in that respect. I do think it's one of the contributions we could make as a profession to demonstrating how we can co-produce at a strategic level as well as an individual level. And I think we could develop more confidence and capacity in order to develop that in our own work, but also demonstrate to others. And I think to do that, one of the things we need to do is learn more from colleagues in the voluntary and community sector. And Mohammed's touched upon that to some degree already, but we've got some incredible examples there of organisations and alliances of people with lived experience making some very tricky and contested decisions, but doing it in a collegiate way in which they are able to come to a shared viewpoint. They might not all agree with it, but they can see the best way forward. And I think we can learn from that, and we can adopt those best practices in our work, and then we can share those more confidently with other professional groups in terms of how co-production can truly influence and shape what we do.
Absolutely. Thanks so much, Robin. That's a fabulous end to that really good question. Thank you. Catherine, I know there's some other great questions have come through to us. Do you want to come in with one of them?
Yeah, but I'm having to say I'm loving Jack's cat. I'm loving it. It's centre stage. Yeah,
there's an extra panelist today.
Just a couple of comments before we come to a question.
Please,
there's a lovely post that said, how were these fantastic speakers selected for this session? So I just thought that was really nice. And also somebody was wanting your pack, Jack, access to that. So if that can be shared, that would be really great. So so the first question, and I will post it. I mean, it's like being in a sweet shop and wanting to sort of, which one will I pick? It's a great position of control here. So right, there was one about influencing other leaders. Yeah. Do the panel have any suggestions about how social work leaders can use their values in leadership roles to influence other leaders in their organisation who may have a different value base, for example, in local authorities? So I'll actually publish that because it's quite a long question, but I thought that was quite an interesting one.
That is a great question, Catherine. I don't know if anyone would like to start with that. Perhaps those working in local authorities. I don't know, looking at Corinne and Jack, perhaps.
What was the question again? Can you?
I've just popped it in there. I've popped it in the Q&A, so hopefully that will.
Yeah, we can. So I can't see in the Q&A.
Oh, can't you? Oh, right.
No, everybody else can. I can't.
Well, it's basically how can social work leadership influence other leaders who may have a different value base, like local authorities?
Oh, it's coming now, actually.
Great, Jack. Oh, Corinne, go for it. Either, both.
Yeah, I mean, I think it's a very good question. And I think we have a lot of those issues, not just at a leadership level, but throughout our careers, don't we, of sort of interrelations with either other professionals that have different value bases, or in this case of local authorities, different colleagues with different value bases as well. I think there's something there about a reflection on what Carmen said earlier about how we value the strengths that each person brings, and sometimes we need to see beyond the the thing that we're disagreeing on and maybe build on the things that we do agree on. I think it's about sort of that motivation and engagement and how we can bring that into those conversations and relationships as well. I think, you know, success is often collective. It's not an individual success. And so when we're thinking about local authorities and those difficulties we can have in those relationships, it's remembering we are all in it together and often for the same outcome. And if we can look at what that shared outcome might be, we can often find a sort of shared solution to that. We spoke earlier about sort of how we articulate ourselves as leaders, and I think in those positions sometimes using the language that the person we're speaking to can be really powerful. I know if we're speaking to health colleagues, for example, we often come across that, well, they call them patients and we call them citizens or service users, and that can be such a barrier to that communication. And sometimes if we just take a breath and think about, right, what are the things that we actually do need to agree on, and what are the things that we can just push to one side as differences that actually aren't making that much difference to where we need to be. And that's sort of, I think Robin said earlier about a diversity of contribution. I thought that was a really powerful statement, because again, it's that we're different, but it doesn't mean either of us are necessarily wrong. It's just how we sort of find that shared ground. I think there's something about being brave, sort of being honest and finding compassion in those conversations as well.
Absolutely, Corinne, thank you so much. I'm just wondering if we want to have some other questions, and then perhaps we'll come back to this if there's time before we finish. Perhaps Catherine, you mentioned there were some of the good ones coming in.
Yeah, there's just some great ones. I think that's a good idea, just to sort of fire through quite.
Let's do that.
I'll publish this one as well. How do we get people to see how good they are? I supervise someone who doesn't see it, and I don't know what I can do to help her see how good she is and what she brings to the team. So I'll put that in the published.
Such a good question. People recognizing how good they are, and we've talked about 360-degree feedback can be helpful, but I don't know who might like to come in on this one. How do we get people to see how good they are? Corinne. Oh, Corinne.
I absolutely don't want to hog the table here, so I'll be very quick.
Okay, super.
I think for me, it's been about motivating staff. It's around celebrating their success, identifying and helping them to see it, and sometimes reframing the conversation that we're trying to have. So we might see them as so good, we want them to be this, and actually it's what do they want to be, and how can we support them to be the best they can.
So it can be about confidence, can't it, and building confidence. Yeah, I know. Carmen, Jack, a couple of quick points on this one, and we'll move on to another question.
I mean,
I was just sorry. Go on, Jack.
No. On you go, Carmen.
Yeah, I was just gonna say, the way I do that sometimes, and I'm not gonna say is the right way, but sometimes for people to realize something they're good at, they need to realize something they're not good at. Yeah, so they can compare how easy or good the outcome could be when they're good at something. So sometimes what I do is, you know, if I don't work in a local authority and I don't manage people, but I'm a program manager, project manager, so I work with a team all the time. And sometimes people tell me, oh, I'm not so good at that. I'm like, yes, you are. So I may say, okay, do you think you're good at this? Oh, no. Okay, so you're good at the other then. Or I may give them a task, you know, that they think they good at. And then when they see the difference in abilities and a skill and a speed, then the realization comes, oh, actually, I'm better than I thought. Or I make them review something that somebody has done that when they think they're not good at, but the other person is. Because sometimes it's about comparing. So they think person A is really good at something, but they're not. So I tell them, okay, can you review it? Yeah. And then they realize they're actually much better than they thought. So that's kind of the two things I use sometimes for people to notice that. Because telling them is no point.
No, absolutely. And sometimes publicly saying, you know, oh, Carmen made this wonderful contribution. Could you say more about it? You know, being generous yourself when you see good practice and good leadership around you is something I've, you know, found to be so helpful too. Jack, did you want to come in with anything else on this?
Nothing major, really. I just think that if someone is sort of identifying that someone doesn't know how good they are, that's a good sign in itself. You know, the fact that they're not able to recognize that in themselves, then I think they're probably on the right track in the first place. And I suppose I manage quite a lot of people actually at the moment, and trying to sort of ensure that people know, when they do a good thing is, my technique is probably to give them more responsibility and say, I'm giving you this because you've done such a good job at this other area, and just be vocal about it. And yes, like tell everyone that, that this person has done a good thing.
Seeing that humility, Jack, that's absolutely true, isn't it? Thank you so much, all of you, for that. Catherine, probably time one, maybe two more questions.
Very quick one from Mohammed. What was the name of the author you recommended who writes on co-production?
Oh, Mohammed, can you remember the name of the person? Is it Joan?
Jan Wallcroft. But there's also Dr. Jan Wallcroft, and also there's also Dr. Peter Beresford that I would highly recommend, and also Dr. Sarah Carr. They're very, very, very well known in the mental health field. But I think Jan Wallcroft was the trailblazer for mental health, to shape it and co-produce it and get people involved, because she used the services and she trained herself to be a researcher, and she changed it from a service user perspective. And a lot of third sector organizations have taken up her initiatives and her way of thinking and doing things differently.
That's great. Thank you, Mohammed. Thanks, Catherine. Maybe one more quick one.
Yes, there's quite a few about models of leadership, which I think is fascinating, and in different sort of professions. But I'll just pick one. But there's lots about models. So what is it about social work? That requires a specific model of leadership rather than looking at sector-specific leadership? For example, in mental health services, statutory children's services, and voluntary sector, as leadership can look very different in our roles, not necessarily by our profession. That's a very long one with lots of tongue time.
But Robin, I guess.
I'll publish that one. So
I'm happy to respond to that. So no, I think it's a really important issue, and I think it's right that we do look at models of leadership that to be developed in different sectors, and a good model will translate across different functions and contexts, etc. And I think the common models that we draw on in social work are compassionate leadership, servant leadership, distributed leadership. All those models that respond very closely to our values. But having said that, I do think there's something quite distinct about a social work profession for leaders to operate successfully. So I do think there's a great opportunity for us to develop a model of social work leadership that would perhaps relate to some of these other frameworks and approaches, but actually would offer something quite unique. And I think that would be helpful, because I think others could learn from our ability to cope with conflict, to respond positively to diversity, and to find a way through difficult solutions. So whilst I'm not at all against looking at other models of leadership, I do think there's something that's not quite hitting the mark for the social work contribution to leadership that I think would be great to articulate as time goes forward.
Excellent, Robin. Really, really good answer. And yourself and others around you were, we're very much involved in sort of teaching and researching and hearing from people about what that should look like. So we absolutely welcome that moving forward. I know we've got one very last Mentimeter, and then Catherine's going to close the session. But I don't know if we want to put that Mentimeter up now and give people a minute to complete it. So it's really kind of your experience of this session, one thing you're going to take away, what's perhaps a motivation or a value or something you've learned, knowledge that's been developed. So something that you want to take away, really. And it's lovely to see the things that have come in. Please do keep responding to that. We can see co-production being such a powerful one, which we are delighted to see, of course. And absolutely, being encouraged in leadership. We've heard a lot about those skills and strengths that are sometimes hidden or perhaps less to the fore because of our confidence in leadership. And I hope one of the things that people will take away from this is actually whatever level you are, whatever your role, whether you're someone with lived experience, you're making a difference, you're leading, whether you're a student, you're making a difference through challenging and being active and asking the difficult questions in your practice placement, or whether you have a leadership role or you're a social worker in a team and don't see yourself as being that leader, you have that opportunity to make a difference, and it's wonderful to see that. I'm sure you'd want me to say a huge thank you and join me in saying a huge thank you to all of our panelists today. We've got Robin, Corinne, Jack, Mohammed and Carmen. What fantastic contributions, and they were chosen as colleagues and partners in various ways with us, so we're delighted to have your input today. And of course, thank you to all of you. Thank you for your input and contribution through the mentees, and also the questions. We're absolutely thrilled to have been part of this session and to have you join us today. So I'm going to hand back to Catherine to close the session for Social Work England.
Yeah, great. I think it's been an amazing session. And I thought at the outset, I thought, gosh, you know, that's a long time, but honestly, it's absolutely flown. And it's just been really great to hear from you all. I think we would like to thank you all for the panelists for their time, and lots of preparation and thought gone into it, and it doesn't just happen. So, and all very busy people. So thank you all very much. Matthew's going to put in the chat our evaluation form. Really keen for you to fill that in, and you know, we really want to hear from you, and how we can do things better, or what you've really enjoyed about this session. Also, we're doing the social work evaluation, and we're sending that through as well. So lots of things to fill in, but we really would value you completing those. So yeah, what I'm going to take is take the liberty of maybe going back to the Mentimeter and just look at the main, the biggest words on each of the slides, if that's okay, because I think
Wonderful.
It's just so lovely to have it. She says, hoping that she can share. Yeah, here we are. So I'll go right back to the beginning and just share everything. So one word that describes your experience of social work leadership, and how lovely is it to see compassionate, supportive and challenging as the biggest, with inspiring creeping in there as well. And there are some negatives, but I mean, that's really lovely. Next one. Can social work leaders ensure positive outcomes for those who use services? Collaboration, listening, communication, co-production, feedback. Amazing. Skills and qualities of good social work leaders: approachable, empathetic, compassionate, listening, reflective. And something you'll take away: motivation, co-production, empowerment, collaboration. Well, you couldn't end on a better note, could you?
You absolutely could not, Catherine. Just to say that we do the University of Birmingham Sky in partnership, and as we mentioned earlier, Mohammed involved in the development of that strengths-based leadership programme. So please do go and have a look at that if you want to hear a little bit more about social work leadership and your opportunity to develop those skills. Thank you so much for joining us today, and thank you, Catherine, and others for all your wonderful technical help in the background.
Well, a little bit glitchy, but we got there. We got there. Yeah. And also a big plug for the rest of the week. We're sort of halfway now. It's quite amazing, and it's just been so great. So please sign up for further sessions. And Jack, you might be interested in pets in social work. the importance of, so sign up. Yeah, thanks everybody, and have a great day, and thanks to the panelists. Been really great.
Thanks so much. Thanks.
Bye.
Bye.